Stress can manifest differently in different individuals. Sometimes it manifests directly as anxiety, depression, indecision, poor concentration, tiredness, whereas at other times it manifests in a disguised way. People become unhappy about their jobs, about their relationships, about the place they live, and sometimes it can also lead to some addictions. People start relying on smoking, alcohol, even sexual addiction can be seen as part of stress. Whereas for others, it manifests in the body form. It can manifest as high blood pressure, asthma, skin disorders, irritable bowel syndrome, generalized aches and pains, chest pain, migraine. So it varies from people to people. It's like when you stretch a handkerchief, it may tear at a certain place, but if you pick up another handkerchief and stretch it, it might tear at a different place. So depending upon where the weak spots are, individuals will manifest stress in that way. So it's very important to acknowledge that the symptom that you're experiencing is related to stress, because something can be done about it. And normally stress is defined as the gap between the demands placed on you and your ability to cope with them. So that gap is described as stress. So there are a number of different ways in which you can deal with stress. Either you reduce your demands that are placed on you, or you learn how to increase your coping strategies so that this gap is narrowed. And that's how you can manage stress. The best way to manage stress is to prevent it from happening, become immune to it. So if you are in a stressful situation, and if you have learned how to be immune to stress, you will not feel stress at all, and you will be able to respond to the situation appropriately. It's very much like tiredness, What do you do to manage or prevent tiredness? You stop the action that causes tiredness, and your body knows how to undo stress or tiredness. In the same way, you need to find out what causes stress. It is not the actual activity that causes stress. It's our emotional reaction, how we react to different situations, that causes stress. So if we are able to control our emotions in a given situation, then we'll find that the situation will not be stressful to us at all. So I would say the best way to manage stress is to prevent it. And we must understand how we can prevent it. There is a consciousness deep inside us that doesn't get stressed. So if we have learned how to connect with that inner consciousness that is equanimous, neutral, undisturbed, then we will not be stressed in a given situation. But if we haven't learned how to connect to that deeper consciousness, then the mind keeps reacting to all the situations that we confront, and we will end up feeling stressed. If it is just a technique, it won't work, or it won't work well. But if it is a way of being, then it does work. But somebody might argue that you can use a technique to access that way of being, then yes, definitely the techniques will work. And there are different techniques that can be used to feel relaxed. And you'll find that the common factor there is how to silence the mind. When I use the word mind, I mean the thinking, judging, feeling, and reacting part of the mind. Whether we use progressive muscle relaxation, whether we use guided imagery, whether we use breath regulation techniques, whatever, you will find that the end result is that the intellect, the judging, thinking, feeling, reacting part of the mind is silenced, and that individual is led into a state where he or she gets connected with the inner consciousness. Some people call it soul, some people call it inner consciousness, or some call it just equanimous consciousness, and that helps. Now, stress is a term that mental health professionals don't like using because it doesn't convey anything and it can't be helpful in treating the patient. So there are some diagnoses with this name, acute stress reaction or post-traumatic stress disorder. But we use these diagnoses of stress disorders only when the person cannot be neatly fitted into other disorders like anxiety, depression, anger, bipolar, schizophrenia, whatever it is. Stress is a term borrowed from physics, and it was initially used to measure the strength of metal, whether it can resist the pressures. And if I were to translate it into psychological terms, then stress is the ability to deal with a certain situation, and if the demands are too many and coping resources are less, then person experiences stress. So it's an overarching term that includes everything: anxiety, depression, fears, anger, everything. Whereas anxiety is very specific emotion which deals with fear in relation to a given situation, in relation to a potentially threatening situation that can happen to a given individual. So basically it's the use of different terminology, but some people use stress to mean general anxiety. The other use of stress is in relation to physical health. Now, some people experience stress in the form of chest pain, breathing difficulties, hyperventilation, irritable bowel syndrome, but it's not anxiety. So the stress has manifested in a physical form rather than the anxiety. Now, cognitive behavioral therapy is based on the assumption that it is the thoughts that are primary and emotions are secondary. So if you really want to control the emotions, you need to control the thoughts, because it's very difficult to produce or create emotions on their own. Emotions always follow thoughts, or if you are in a given situation that is stressful, then emotions can occur. So if you really want to control your emotions or symptoms, then either you control your thoughts or you control the external circumstances, your situation. Most people resort to the second option. They try to control the external situation and want to change the environment around them. But people who are introspective, reflective, they understand the deeper reaches of the mind. They know that controlling their thoughts is a better way of dealing with stress than trying to control the external circumstances. So people have found that this cognitive behavioral therapy is more effective than other forms of therapy. And here the cognitive therapy has merged with the behavioral therapy. That's a marriage between behavioral therapy and cognitive therapy. Now, why this marriage took place? It's because cognitive therapy was a little stronger on the theoretical side, but weaker on the therapy side. And behavior therapy was stronger on the therapy side and weaker on the theoretical side. So they kind of merged together. And the behavioral therapy says that the behavior is primary. So you can execute a behavior, and in trying to execute the behavior, you will overcome certain thoughts and emotions, and then you can overcome them. So it works very well, and the research evidence suggests that cognitive behavioral therapy is one of the most effective therapy techniques.